mean, the evolution of it is, just literally having that idea like, could I be a recruiter? Is there something, that exists right now? Of course, there's recruitment agencies, but is there something specific to public health? And so I kind of went down that rabbit hole a little bit and, did some research online. I didn't find anything that was specific to public health. Also, just kind of acknowledging again that need that I had and that I've sat in and that I've watched, other colleagues sit in with that frustration of not having qualified personnel for their roles. Um, and then just kind of talking to some of my colleagues and trusted friends and family, like, hey, let me run something by you. I have this idea. Do you think that it would work? Is this something that you feel like there's a need for? And do you think that I have the personality to really pull it off? And then after hearing, so many yeses, I think this makes sense. There's a need. I kind of just rolled my sleeves up and, did the formal stuff in terms of like filing, for the business and things like that.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 35. Hi everyone, Omar Richards here. Thank you all for joining me today. I appreciate you all so much listening to this. Definitely make sure you subscribe, review, leave a comment, share it with a friend, share it with your friend's friend, send it on an email list, anything. I appreciate it a lot. But today's episode is a really great story, really great insights on the recruitment process and a lot of tips on like entrepreneurship and public health, as well as just the public health path to get into this place and a mindset. And I think that you all are going to take value from this. I know a bunch of you are probably following this person's business account on Instagram, and definitely make sure that you go to the website, upload your resume, and they are going to try to help you get public health jobs. It's absolutely free on you, so definitely tune in and do that. And without further ado, here's today's episode. Enjoy. Today we have a public health professional with over 17 years in public health practice. She has gotten her Bachelor of Science in Public Health from Florida State University. Then she got her Master of Social Work at Florida Atlantic University. She has experience in recruitment and development of public health professionals, as well as proven experience leading and managing public health programs and initiatives. Catch her on Instagram at the Public Health Network. We have Brooke Mootry, MSW CHES. Welcome to the show.
Awesome. Thank you, Amari. I appreciate you having me.
Yeah, my pleasure. I'm really glad to connect with you. Like, I didn't know that you were behind Public Health Network until very recently. So I'm glad that we get to formally connect and just definitely talk about your story and whatnot.
Absolutely.
Yeah. So how are you doing, and how have you been coping during these times?
I'm doing, I think, fairly well for the most part. All things considered, what's happening, with COVID and things. It has taken me some time to adjust to this new normal, particularly just kind of being in the house all the time and, on the computer a lot more than I prefer and than what I like. Yeah.
Yeah, definitely understand that. I've been myself feeling like I've been sitting down a lot more than I would like if I was in office. Like today, I just went outside and walked for 30 minutes. So
Good.
I'm definitely gonna try to do a lot more of that kind of stuff. How do you identify? And then tell us a little bit about your personal background.
Sure. So, I identify as a public health professional, pronouns, she and her. Just personally, I was born and raised in South Florida in Fort with my parents and my older brother. And just in terms of personal interest, I love photography. I have a developed interest in that kind of keeps me busy sometimes. And I have an affinity for animals. And so prior to the pandemic, I would go and volunteer at a like this animal shelter. And it just really helped me connect with animals and just kind of get my mind off of things. So that's me in my spare time.
Okay, awesome. What's your favorite animal?
A dog, without a doubt. Just,
Yeah.
I don't know, you may see the stuff around me, but absolutely, definitely
Okay.
dogs.
Okay, awesome. I actually like just recently filled out an application to become like a foster parent of pets, I guess. So
Yeah.
hopefully I can get some dogs in the next couple of weeks and that'll be cool for
Oh
me
yeah, that's
myself.
exciting. You have to debut them on your Instagram account. I would love
I
it.
know and I think like this would be like the intro to when I get them because I'm thinking I'm gonna get it sometime next week and this is gonna come out next week. So definitely
Love it.
awesome.
Love it.
Yeah. So what does public health mean to you?
Um, so to me, I think with public health, it's the traditional definition that we've all learned in school, and promote and protect the health and safety of the public and the community. But for me, I definitely believe in that, and it definitely means the same thing to me. But I also think public health is the opportunity to really transform the trajectory of an individual's life and also the lives of a community. And I think now more than ever, we've heard the adage that health is wealth. And I think we see that with COVID, but with public health, you truly can impact the trajectory of someone's life, for hopefully for the better than the worse.
Yeah, absolutely. And that was a beautiful explanation. So thank you for that.
Oh, thank you.
So you got your Bachelor's of Science in Public Health from FSU, or Florida State University, I should say, for people who don't know.
Yeah.
So before, like, did you go into undergrad as a public health major?
I absolutely did not. And even, I have to acknowledge kind of the elephant in the room because I know you went to the University of Florida. And so for those of us that, we're pretty familiar with the dynamics between the two colleges, but thank you for having me on the show. It speaks volumes of your character. And I have to ask, I mean, why not Florida State? And I know this interview is not supposed to go that way, but Florida State, man. You did University of Tampa and US? Amari.
Yeah, and I have a cousin who always like makes fun of me for not going to FSU, but I think Gainesville and Gators are a lot better. So I'm gonna like I've been up to FSU and I don't know, I just like the vibe down here a little bit more.
Yeah, fair. Totally understand. And some of my best friends are Gators, even though I hate mentioning it, but I just had to put it in there. So
Yeah.
in terms of Florida State, I did not enter undergrad with the intent of graduating with a degree in public health. I actually started out with believing that I was going to be a physician and go on to medical school. But early on, I would say within like the first year and a half, just being fully transparent, I struggled with math and sciences. And so chemistry and biology, I got to a point where I was tired of retaking it. And I'm like, what else is out there? This may not be the career for me. And I remember one day just kind of opening up the computer and going onto the website and just scrolling through the different degree programs and offerings. And I came across community health education. And at the time, this was early 2000, 2001, 2002. They didn't have a degree in public health. So the option was either community health education or school health education. And I decided on community health ed.
Okay, fascinating. So you went in as like a biology major or you were like undecided?
Went in as biology major.
Okay.
So, yeah.
Yeah, and that's completely fair. I feel like people definitely like, oh yeah, I want to be a doctor, but then when they have to take the bio or the chemistry or the calculus or whatever it is, it's like, oh, I don't want to do this
Yeah,
anymore.
it gets real.
It does, especially
Yeah.
when you have to retake classes. And I retook quite a few classes, and it
Yeah.
definitely is not fun in any
Yeah.
sense. So,
Yeah.
were there any experiences like throughout your undergrad that you want to talk about?
I had a pretty, like I said, I started out pre-med, found community health education, and then early on, I was just very intrigued with health belief models and theories and things, and just the idea that you can change a person's behavior, and their health and things like that. And so, a couple of the experiences, I ended up getting involved in a community organization on campus where we did a lot of health education and going to dorms and talking about different subjects from tobacco to safer sex and violence prevention. And in that moment, I really felt like this is natural. This is where I'm supposed to be. And then prior to graduating, I found more of an interest in sexual and minority health, in particular HIV. At the time, CDC had a lot of information and things around Black women and HIV. And as a Black woman, that really resonated with me. And so that I definitely think was influential in my career. And the internship that I did in undergrad was with a local aid service organization. And so I got that kind of on the ground experience with counseling and testing and doing outreach and things. And that just further cemented that I had made the right decision and I'm a better health educator than physician.
That's fair. I mean, need health educators out there. I feel like there's
Absolutely.
a huge need for these sorts of positions, and there isn't, I guess, as not enough acknowledgement of the need for these positions. I feel like we talk about the lack of like physicians all the time. There's a lack
Mhm.
of so many different public health professionals, and I think that we need to be able to advocate for the value in those positions, and it's hard as I always say, like prevention isn't sexy, and we
Yeah,
need to like change that dynamic. Um,
right.
yeah. So you also got a digital photography certificate from
I
Emory. Was this through when you were in undergrad?
No, so that actually happened a little bit later. I moved to Atlanta in 2010, and as I mentioned earlier, I have an interest in photography, and at the time, I had just invested in my first DLSR camera, and so it was a pretty big investment, and I just wanted to make sure I was using it properly. And so I found a continuing education and figured why not? I have 12 weeks to spare, and it'll also help me learn the camera, but just a way to kind of continue education in something that I had an interest in.
Okay, cool. So was it a Nikon, Canon, Sony?
Great question. I'm definitely team Nikon.
Okay. It's so interesting to hear people talk about photography, and like once they get into one or the brands, they stick with it and
But
they're like diehard fans, and it's
yeah.
interesting. Okay, awesome. So after your bachelor's and after this certificate, you went on to get your master's of social work at Florida Atlantic University. So why
Right.
did you not want to go on to get your master's of public health?
So good question. So after I graduated, the ASO, the AIDS Service Organization I mentioned earlier, they did offer me a position, but I ended up just returning back to South Florida, and I got my first public health role as a health educator at the county health department. And within the health department at the time, they were offering tuition reimbursement, so that was a great incentive for me to kind of stay in that role. And when it came time to determining, what I would get my master's in, at the time, I looked at public health or the MPH as kind of an advanced undergraduate degree that I had. And so I really wanted something that would be different and not just kind of learning more about the same information I learned at Florida State. So I settled on social work. I felt like it would just give me a more broad perspective and skill set. And then now, years later, it's been, probably about 12 years since I've had that degree. Now you see a lot of programs that are combining both the MSW and the MPH degree. So that was really the catalyst for the decision at the time. I did go part time. So while I was working full time, it did take me 4 years to complete the degree. So, by the end of the 4 years, I was kind of like over it, whereas all of my colleagues had their MPH within like a year or two. I was a little bitter, after the end of the 4 years just because of time.
Okay, would you how did you feel about that experience doing it part time, working a full-time job? Do you reflecting back on it now?
Yeah, reflecting back on it, I mean, I think it was the best decision for me because it allowed me to continue to get that full-time public health experience, and it just really paced the graduate program. I think had I done it in 2 years, I probably would have missed out. Definitely would have missed out on some of the experience that I had at the county health department. So, although I started as a health educator, by the time I left the county health department, which was about 6 years later, I ended up leaving as a program manager in tobacco prevention. And so that experience really helped give me different skill sets that later served me in public health. So looking back, I'm grateful that I went part time. It just kind of looks better on my resume.
Fair enough. Fair enough.
Yeah.
Are there concentrations with the Masters of Social Work, and did you have one?
At the time, there was not a concentration, so it's just a general MSW degree. I was able to tailor a lot of the projects and focus on public health. And so it was pretty rare, in at least the cohort that I was involved in, to have someone that had a public health background that was in the MSW program. And I actually ended up connecting with one of my professors who had a similar background. And so she ended up becoming a mentor to me and offered me some opportunities to delve into public health research and things like that. So that was pretty helpful and benefited.
Okay, and talk a little bit more about how you cultivated that relationship to get that experience to work on those
Sure.
projects. And you said in undergrad you were interested in HIV/AIDS. Was that anything of interest, or like working with those type of clients or populations during your Masters of Social Work?
So I definitely continue that same theme of HIV throughout the MSW program. And the professor, like I mentioned, for the most part, all the professors at the time within the MSW program, they all had a very strong social work background. And then, towards the end of the program, there was this new professor that, at least new to me, that had a public health background. And so she had direct public health practice experience in the same way that I did. And a lot of the work and reports and things that I would write or papers would focus on public health. And so I think just having that similarity helped that relationship. But I also forged it by reaching out and asking if there's any projects or anything that I could work on, and shared a little bit about my career goals and what I was interested in. And she also was interested in HIV. And so that just, again, having those similar interests really just naturally evolved into a mentorship.
Okay, awesome. And were your career goals then the same career goals that you followed in your
Oh,
trajectory?
great question. So my career goals at the time, I think, were probably to stay in HIV and then go to the CDC. I think that's like the ultimate goal for a lot of public health professionals. At the time, I didn't see myself, where I am today with the public health network or um, some of the other things that I've done in my career. I don't think that I planned on this. And I wouldn't have seen this one coming.
Okay, fair enough. And then one last thing here. So you
Yeah.
said that in undergrad you had friends who went on and got their MPHs, Masters of Public Health. So have you like spoken to them, and what's the feel for the difference in the degree and like the career
Yeah.
trajectory and different things? Like would you have gone back and done your MPH instead, or not really?
You know, that's a great question. So my colleagues that have gone on to get their MPH, we still keep in touch. They're still working in public health. I can't say that their trajectory is that much different than mine. I will say that, in terms of certain technical skills, they do have more experience, particularly when it comes to data sets and things like that. I never, really delved into that. As I mentioned, an undergrad with math and science. So they definitely have that skill set. If I would do it differently or if I would do it over, I can't say that I would go on to get the MPH. I can't say that I would. I think the social work degree it just kind of makes me stand out a little differently within the public health field, and I haven't had any true concerns at this point.
Okay, definitely. And before I forget, what type of photography do you like to do? Is like the photography of the animals, or?
No, great question. So, not animals, but I love documentary photography. I love just, things that aren't posed, that are just documenting different times in history or different cultures and things like that.
Okay, thank you for
Sure.
that. So you graduated with your MSW, and then you said you got this program manager role at Broward County Health Department.
Right.
So was that after graduation? Did you get it before, or what was the process for that?
Great question. So again, I started out as a health educator, and while I was earning my MSW, there was an opportunity to join a position as a public health social worker at a family planning clinic. So I applied, got the position, loved it. It's kind of in line with social work and public health. And then maybe a year into the position, Omari, there's a budget cut, and so I remember just being called into an office one day and saying, "Hey, there's a budget cut. You're the last person on the team that's hired, so we do have to transition you from this role." And that transition was into tobacco prevention and a tobacco prevention specialist. And so while I was pretty upset at the time because it was unexpected, I didn't see it coming, that was really something that worked in my benefit, because although I didn't have an interest or connection with tobacco prevention, the skill set and the information that I learned in that position served me later on in my role at the Department of Public Health. And particularly with tobacco prevention, it was the first time I was really introduced to public health policy and doing work around the Clean Indoor Air Act and things like that. And that foundation and that knowledge just served me. So that's kind of how that happened.
Okay, thanks for that. So considering that you didn't get your MPH, how difficult was it to get a grasp of the policy part of the work, or was that a challenge at all?
It wasn't that difficult. I will say within the field of tobacco prevention, the colleagues are very forthcoming with information and technical assistance and, really working together. But as far as the policy part of it, I didn't necessarily have too much of a challenge with it. And I will say that I, surrounded myself with supportive colleagues that kind of helped along the way.
Okay.
But if you were to ask me today to like analyze a data set, I'd be like, I know a few people that can help you with that. So I definitely know my area of expertise, and I absolutely stay in my lane.
Yeah, and talk about the importance of knowing your area of expertise, and I know we're going to touch on it a little bit later when we talk about the public health network, but would you like to just touch on it now?
Yeah, but in terms of knowing, I think it's just knowing yourself and knowing what you're capable of, what you're comfortable with, but also that fine line of not wanting to challenge yourself, because I think it's easy to say, oh, I don't know data, it's difficult, that's not who I am. But that's an easy way to say it, or you can kind of put in the time and increase your skill set, increase your knowledge. So staying in your lane to me is just, I know myself, I know Brooke, I know the areas that I excel in, and that's happened over time. I think, early in my public health career, just starting out, I think I had some hesitations, reservations about a lot of things, but over time, I know the areas that I start to excel in and lean into more than I do others.
Yeah, awesome. So then after your role as a program manager, you moved on, I guess you moved to Georgia to work for the Department of Public Health. So how did that transition come along?
So the decision to move to Atlanta was really just, as I mentioned, I lived in, South Florida the majority of my life, and just wanting something different, wanting a new environment. And then with Atlanta, I think at the time I mentioned that, the goal was to work at the CDC, and, CDC is in Atlanta. So just looking for positions, I came across the Georgia Department of Public Health hiring for a state adolescent health coordinator position. And I applied, and I was able to leverage my experience from the previous positions at the health department to attain that role. And so they were looking for someone that had experience in adolescent health, which in my health educator role with HIV, I worked with a lot of adolescents and schools and things like that. And then also in the role with tobacco, worked with schools as well, and that policy piece. And so transitioning from the county health department to the state health department, you're kind of getting into that macro level, and you're looking at things at a state level versus more of a local level. And so the experiences that I had just really layered on and helped me, I guess, identify or present as the best candidate for that position.
Okay, awesome. And you began in that department as a state adolescent health coordinator. So what did you do in that role?
So that position, there was definitely some policy work because the program was funded by state legislative funds. And so that was the first time that I was introduced to more of a high level program management. And so there was a lot of contract monitoring where we would get money that was appropriated from the state legislature, and we would allocate it to local health departments throughout the state. And really my role was monitoring the contracts and making sure that they are meeting the deliverables of that grant or of that funding cycle, and was particularly around pregnancy prevention. And so a lot of evidence-based intervention around targeting youth and making sure that they are kind of given the skills necessary to make healthy decisions. And so with that role, again, it was more high level contract management, also some program management with budget as well.
Okay. So did you have to do a lot of, was it a bigger workload than you were used to? And were they like techniques you had to use to manage that in process? Because I know I've spoken to a couple people, and they, when they moved into a similar role, when they're high level managing things, there's a lot of things going on.
Right.
So yeah, do you want to talk about that a little bit?
Yeah, it was definitely a huge transition, going from one role as a tobacco prevention specialist or whatever at the health department to now at the state level. As I mentioned, you're now looking at things from a higher level, not just in one specific area. And so some of the decisions that I had to make in terms of like allocating funds, that was something new to me. And so what type of algorithms or measures am I using to determine how much money one area gets versus another, and kind of looking at data and the burden of teen pregnancy and kind of aligning things there. So it was absolutely a huge learning curve for me. And so I think that first role, I think it was, serious imposter syndrome. Like, how did I get this job? what am I doing? The whole state of Georgia and their teen pregnancy rates are kind of on my back. But I think over time and knowing when to ask for help has really helped me and helped me advance in that role and really get comfortable. I would say by that second year, third year, I had it down pat and kind of understood the decisions that I had to make and the implications of those decisions.
Okay, awesome. And how did you measure out those allocations? Like, I mean, I guess what are the criteria for those allocations?
So, I started with just looking at the total amount of funds that were available to allocate to local health departments. And then I did work closely with our data and evaluation team that we had within the department. And so they would pull different data around just teen pregnancy rates. So we'd look at that. Also, we would look at other factors like HIV infection and the rates for certain age groups. And then based on the burden of disease, we would come up with just an allocation, a certain percentage, if you will, to allocate the funds that way.
Okay, and if someone doesn't know what burden of disease means, could you explain that?
Okay, great. So what we would look at with, so for example, looking at a county in the state of Georgia, whatever we're looking at, we would say, and I think this is where my public health degree is kind of like lacking, right? That MSW is really shining. Within a certain area or a certain group of people, what is the burden or how impacted is this group or this area with this certain disease or this certain risk factor that we're looking at?
Okay, thank you for that.
Yeah.
And then you were promoted, I'm guessing, into the next position as a State HIV Prevention Manager. So how did this promotion come along?
Sure. So I was in the adolescent health role, I believe, about 3 or 4 years. And like I said, after around that third or fourth year, I was kind of looking for something different, maybe a different challenge, but still within the state level. And so there was an opening within the Office of HIV/AIDS, and much of my background from even the internship in college and my first position was in HIV, and so that passion and that interest was still very much present. I applied for the position and was selected as a manager, and so a lot of the same needs for that adolescent health position were necessary for the prevention manager. I would say kind of the only difference is it was just a larger team of individuals that I was now supervising, definitely a larger budget. And then I would say more engaged community members and advocates in that role, absolutely.
Okay. And do you have any advice for going into managing teams?
Great question. So I would say definitely invest in continuing education and training around management, around building teams, understanding different personalities. And, going back to what I shared earlier, just again, knowing yourself and knowing what you're comfortable with, what you feel like you excel in, and what you can share in part on your team. And if there's something that you feel like a team member needs or that you're not able to provide, being able to leverage that and seek, outside support or assistance.
Okay, awesome. And then what did you do in this role?
So in the role, it's still at the state level, it's a lot of contract management. The difference is as a manager, now I'm managing, not necessarily managing those contracts directly, but managing the staff that look at the contracts. There's also a lot of policy that's involved in this role. And so as different bills get introduced, they have certain subject matter experts that are called to kind of do like a first read or take a review at a proposed bill. So that's some of the things that I do in that role, seeing if someone's proposing something on HIV prevention, how does that impact our budget? Will it make an impact in the state? Is this something that we should pursue? And just providing my recommendations that way. The other things that I do is, again, just looking at the goals for not just the state of Georgia, but for CDC, which funds the position and funds the program that I supervise, and coming up with ways to meet those deliverables and kind of pushing the trajectory of HIV prevention in the state of Georgia.
Okay, awesome. And you got certified health education specialist or CHES certified. So why did you get this?
I think so that CHES certification came a little bit later while I was still in the role as the HIV Prevention Manager in Georgia. And I think that was more just being honest, I think kind of, I don't want to say making up for that MPH, but feeling like I may need some more public health credentialing behind my name. And so took the exam, and I actually had a great opportunity a few years later, which was to sit on the standard setting board for the CHES examination. And I think that we might have been in 2000 and I don't know, 18 or 19. And so I had a chance to go to Pennsylvania with about maybe 9 colleagues from across the U.S. and look at the standards for the exam and kind of set them. So that was a great opportunity that, almost came out of just nowhere.
Can you talk a little bit more about that? Like, what would you guys like? How do you go around setting those things?
Right. So we looked at the exam and the different standards. I think there may have been 9 or 10. Don't quote me on that. And we kind of broke in different groups and looked through each standard, looked at the scores, the average scores over a period of time, looked at what was required in those standards, and then based on our professional experience, did we recommend any changes? Is this something that should continue as a standard? And interestingly enough, I almost did not take advantage of that opportunity. It was actually my mentor that said, Brooke, you need to respond to that email and say that, yes, you're interested and that you're going to do this because it's going to serve you later, on your resume and in your public health career. But initially, when I saw the email, I was like, oh, this is just something to do. I don't really have the time to do it. And, I'm so glad that I have a mentor that told me to take advantage of it.
Okay, yeah, that is awesome. That is good that you did have the mentor to help you take advantage of that. So how often is that done? Is that done every year?
No, it's done every few years. I would say maybe every 3 or 4 years. So when we got together, we were the first group probably within, like I said, maybe 3 years. It doesn't happen every year at all.
Okay, yeah, that makes sense. Okay, and now moving on to
Sure.
your current position as the CEO and lead recruiter at the Public Health Network. So, I guess first start off by saying what is the Public Health Network?
Right. So the Public Health Network is a full service firm that specializes in the recruitment and development of public health professionals. And ultimately, the goal of it is to help individuals look forward to Mondays, to really, not just individuals, but public health professionals specifically, to be in a position or be in a space where they're excited to go to work and, Sunday they're not getting the blues and kind of dragging their feet, but they're actually starting the week with enthusiasm because it's the type of work and the work environment that they want to be in.
Okay, and when did you start this?
So the Public Health Network started formally in 2019, the fall of 2019.
Okay.
But prior to that, I think it was kind of in progress and development just through the different experiences I had throughout my public health career.
Okay, so when did you get like the bug, like one knowing that you wanted to do something like this? Like when did that point in time happen?
I would say probably earlier that year, earlier in 2019, where I was just kind of thinking about, next steps. What else am I going to do in my career? Where do I want to go from here? And just looking at the experiences that I've had and things, again, that I'm interested in or that I've naturally gravitated towards. And in the roles, particularly at the state office, one of the things that I continuously noticed were 2 things. One, just sitting on interview panels and interviewing individuals that may not have presented themselves the best way that they could have for that position. So on paper, they had the experience, they had the skill set, and then for the interview, nerves or whatever, they weren't necessarily presenting, I think, all that they had to offer. So that, I think, was a buildup over time and just sitting on different interview panels. And then the second thing I would say would be in my role as the different manager roles that I've had. And, with just natural cycles of staffing and management, you have individuals that leave and move on from positions, and you're left with vacancies, and you either have to make decisions to delegate the existing work or, take it on for yourself. And so I think that's where that recruitment idea came from. It's like, I wish there was a place where I could just go and find someone that had the skill set that we were looking for, rather than posting positions and kind of sifting through a lot of applications and sitting in interviews.
Okay, no, that's kind of cool. That I guess being in the interview process and seeing people like they're seeing their resumes and like seeing what they had to offer, and then hearing them speak, and it's like seeing that they fell short of what they had to offer, and really trying to maximize that. I think that's a really cool thing to think about, and I feel like a lot of people do need that help. They do have those nerves, so that's awesome that you did. So can you tell me a little bit about the evolution of this? So like, And I know it didn't start as a website. It didn't start as a firm. Like
Right.
how did it begin? Like when would you say it officially began, and like what led up
Um,
to that?
So I think, I mean, the evolution of it is, just literally having that idea like, could I be a recruiter? Is there something, that exists right now? Of course, there's recruitment agencies, but is there something specific to public health? And so I kind of went down that rabbit hole a little bit and, did some research online. I didn't find anything that was specific to public health. Also, just kind of acknowledging again that need that I had and that I've sat in and that I've watched, other colleagues sit in with that frustration of not having qualified personnel for their roles. Um, and then just kind of talking to some of my colleagues and trusted friends and family, like, hey, let me run something by you. I have this idea. Do you think that it would work? Is this something that you feel like there's a need for? And do you think that I have the personality to really pull it off? And then after hearing, so many yeses, I think this makes sense. There's a need. I kind of just rolled my sleeves up and did the formal stuff in terms of like filing, for the business and things like that, the website, um, building content, and a lot of it, early on was kind of building as I go. And what I mean by that is with the Instagram account, for example, developing content for that. I think I underestimated the amount of time that would go into that. And so I see you nodding your head. It sounds
Yeah.
like you can relate to that. So that was something, like early learning lessons, and just being intentional about, again, my skill set, what I can offer, and not trying to be intentional about not growing too fast, too quickly.
Okay, awesome. So you said that you got a lot of yeses, but I want to talk about the no's that you got, and
Right.
how did you like hear them say no and then be like, ah, forget what you got to say. I'm gonna do this though.
Right. So the no's that I got, and it could have been that I was, one of the people that I was talking to, shared just, being very selective about who you share your ideas with. And also understanding that who I'm sharing my ideas with and, just anything, they're going to give me their response or their feedback based on where they are in life. And so understanding it and approaching it with that frame or that mindset or that lens helped me to filter, is this person a little jaded? Where are they in their career? Could that possibly be influencing their decision? And so the no's, quite honestly, were very few. And when I say I talked to a few people, I think it was probably less than 10 people. So it wasn't, this huge sample that I pulled from. Um, I think the no might have been, oh, it's difficult to get clients. Oh, it takes a lot of time. Why don't you start at a recruitment agency, get experience, and go that way? And I'm like, okay. And then here's what I'm going to do. The yeses are outweighing. I know I have the desire to do this. I'm just going to, vote on myself and see what happens.
Okay. And so tell me why you didn't want to go to a recruiting agency before, and you want to just do it yourself.
Great question. So I felt like, and I always look at time, like how much time is this going to take me, which is why I mentioned I was so bitter about the 4 years with the part-time MSW. But if I go to a recruitment agency, one, I know it's not going to be specific, or it's a low chance it's going to be specific to public health. So I would have to learn, a different field or an area to actively or effectively recruit. And then two, the spending at this agency, could I not put that same time in and build my skill set and make it specific to what I'm trying to do? And I didn't want to get it caught into that, I don't want to say that trap, but that race of staying at an agency, trying to prove myself, and ultimately knowing I want to start my own business. And so I think there's a lot of resources out there online that, and I'm smart enough, I can figure it out. And so that's kind of how I went for it.
Yeah, definitely, and that does make sense. And there are so many resources outline,
Mhm.
especially online, especially now. So what were some other challenges that you had besides like coping with the time consumption of creating social media posts?
I think the other challenges would be um, learning the art of selling, just being
Mm,
fully transparent because it is about, recruitment and finding companies or finding agencies that are willing to invest in you and give you funds. And so that I think I probably underestimated that in terms of the need to sell and how much time and the challenges that come along with that. Um, and then I think the other thing is just balancing, again, time with working full time for the Department of Public Health and then starting this new business. And I think early on, I'm excited about it, Public Health Network, and I just kind of want to quit my job and say, hey, I'm doing this full time. But then, reality is like, or, I use that word loosely, reality is, hey, you have some other responsibilities. Some of them are financial. Let's get on a roll before you really pull that string and do this full time.
Okay, and yeah, that absolutely makes sense. Definitely don't just like drop your job and try to do something from scratch, because it's not going to kick off. Especially like if you like started in like, let's say February or March, and then boom, the pandemic hits, everything changes.
Yeah, everything changes. But you know what, Omari, that was the best time for this, for this type of work, for public health in general, but also for recruitment, because now you have businesses or agencies that now have a surge in need for public health professionals that are looking for epidemiologists or COVID tracers and all these other titles. So I kind of kicked myself, early on, like, man, I should have had more set up. I should have been ready to do X, Y, Z so I could really take advantage of some of these opportunities that are out there for recruitment contracts. But it was a lesson learned.
Okay. Talk to me about recruitment contracts.
Okay. So, I mean, it's the same thing as like I talked about a little bit early on, but finding companies that are willing to sign a contract with you. And so they would hire the Public Health Network or contract with the Public Health Network to fill one or two or several positions for their agencies. And so the contracts are very specific. They talk about the timeline, the type of personnel that they're looking for, the skill set, experience, etc.
Okay, so are you like on retainer, or do they hire you to just fill certain positions in the contract, or is it like a specific time period?
Right, great question. So there's different contracts. Some of them are on retainer. So if they have any vacancy, then they would tap into the Public Health Network. And then others are just very exclusive for a specific role or specific position. And usually, sometimes the time frame may be 30 days, 45 days if it's a very difficult position. But once that timeline comes up, I have basically 45 days to hand them X number of qualified candidates to interview or screen.
Okay, and what is the process like for looking for X number of qualified candidates for those positions?
So it starts with working with the hiring manager at the company and really understanding what they're looking for. They'll give you the general stuff. This is the position, this is the number of years experience, this is the education requirement. But, what I've learned to really be successful is going beyond those, those details and really learning what type of person do they want in this role? What's the hiring manager's personality? Are they very hands-on? Do they want someone that is looking for mentorship? And just finding out more about the person who's going to be supervising them. Because it's easy to find people on paper that meet what they're looking for, but the personality, I think, is more of that challenge. And so it starts with that process. And then from there, working with different recruitment sources, whether it's, the traditional job boards like Indeed or Idealist or things like that, or that are geared towards public health professionals or individuals that have that type of background. And then depending on the need or the requirement of the client, doing a little bit more digging where you're picking up the phone and you're cold calling clients and saying, hey, Omari, it's Brooke from the Public Health Network. I have this great opportunity. I saw you on LinkedIn. It looks like you have the experience that they're looking for. Are you interested in exploring a different opportunity? And kind of having those conversations. And so once, I pull those candidates that meet the criteria, then it moves on to screening candidates. And so we do something very similar to what you and I are doing now, which is just having conversations virtually. We'll ask about their experience specific to the job announcement or whatever I'm recruiting or sourcing for. And then from there, just presenting the qualified candidates and going back to the company and saying, hey, based on what you shared, these 5 people or these 10 people or these 3 people, I think would be best in this role. And so from there, they start the interview process and kind of move forward with their internal hiring.
Okay, and how intensive is it, those conversations when you're reaching out to people who you think are qualified for roles?
So it's not, I definitely try to be very approachable, particularly if I'm calling someone that hasn't applied for the position. I'm almost like trying to get them in if I think they're going to be a good candidate, but it's not so much intensive as it is more of a conversation. And really on my end as a recruiter, I'm trying to find out in, 30 minutes or less, does this person truly have the experience? or is it just on paper? Kind of talk about some examples, tell me when you've done this. And then, do I get a feel with their personality in these 30 minutes that they're going to mesh well with this hiring manager? And so that's, I wouldn't call it intense, at least not with myself. I think with some of the other recruitment agencies, it could be intense, but definitely not with the Public Health Network.
Okay, awesome. Tell me a little bit about the numbers. Like, how many people are we looking at, like macro, to how many people are we reaching out to for positions? How many people are then going, I guess, to
Yeah.
further parts of the interviews?
Okay, great question. So, and again, it depends on the type of role that I'm recruiting for. So a very general role that I recently recruited for is a program associate position. And I'm trying to, not give too many details about the company or about the hiring manager's needs. But with that position, I did some sourcing online. So I did use Indeed, and I think I used Emory Public Health Connection to advertise the position, and a couple of other measures. I think I tapped into a couple of Facebook groups and things like that. So in that position alone, it was a part-time position, and they were looking for someone that had an MPH degree. I would say maybe 2 to 3 years of public health experience. In that position alone, I had well over 1,000 applications. And so with that, I do like ongoing screening. And so I'm looking at these applications, and most recruiters will see this online. They can look at an application in less than 10 seconds and see whether or not they're going to move it on to the next round. And so of that macro 1,000 candidates, I'm not waiting until 15 days, until the position is due, until the candidates are due, but I'm just ongoing as they're coming in. I'm taking a look at it, checking off yes or no, moving it into a pile. Dwindling that down, I would say of the 1,000 applications, you probably have about maybe 200 to 300 that actually have the qualifications. And then from there, I think I narrowed it down to maybe about 50 people. And then of those 50, I had the virtual screenings with about 20 of them.
Okay, awesome. Thanks for that breakdown. What types of organizations do you work for? Is like health departments? I don't know if you can say what if you're available to say what types of organizations.
Sure. So I've had success with more nonprofits than I have health departments. What I found with a lot of government agencies is that they have contracts. And so they may do an RFP, a request for proposal, for a staffing agency or temp agency. And so you have to bid for certain contracts. But I would say most of my success has been in the nonprofit arena. But I do hopefully expect to get some of those health department contracts any day now.
Yeah, definitely think you will, definitely. So you also said that recruiters are able to screen people really quickly. What are some of the I guess tips you would give someone to improve like the chances of being chosen for this?
So I think definitely making sure that their application matches the job description that they're applying to. So I think the familiar advice is making sure you're pulling out those keywords, putting them in your resume. Metrics absolutely help. So if you have a few of those keywords and then also in your resume, I'm able to see results or outcomes where you've applied that knowledge or you've had some success in the area. And then I would say the more experience, the better. So if I'm looking for someone that has experience in environmental health, 2 to 3 years, but you have 6 years and you've applied, then I'm going to look at you and say, okay, well, this person meets the criteria, the minimum criteria. It looks like they have a little bit more. What else can they offer?
Okay, awesome. And do you also cater to person's needs like beyond I guess just like the job hunt, like I guess I don't know how to say this. I don't know how to say this. Let's just
Yeah, I think I understand what you're asking. So initially we started out with recruitment, and then we found definitely a huge response to the Public Health Network. And so we would get a lot of calls, or emails or things like that saying, hey, I'm looking for a job. Can you help me find a job? And so that kind of, set off some light bulbs and said, well, there's a need for people. There's more people that are calling and saying, hey, I'm looking for a job. Can you help me find a job? Versus clients that are calling in and saying, hey, I have this position. Can you recruit for me? So early or late in 2020, we expanded to professional development services. And so outside of the recruitment, then we do offer one-on-one professional development for public health professionals to help them get the positions. Again, going back to our mantra of just getting people to look forward to Mondays. And so we have a couple of different packages that we offer along with career coaching. So no matter where somebody is in their public health career, we definitely want to be their go-to resource to help them get to the next step or get over whatever hump that they may be in.
Okay, awesome. What is some advice you'd say, like if somebody did want to reach out to you and they are looking for a job, like how should they reach out to you? What's the best way to do that?
So the best way I would say would be through our website, which is thepublichealthnetwork.com. On our website, there's a form that says connect, and so an individual can put their name and email and their phone number in there, jot down exactly what they're looking for, and then either myself or a consultant will follow up with them and talk about their needs and how we can best help them.
Okay, awesome. So you guys know where to check her out. So definitely go
Yeah.
and do that. And as you said that, you said you work with other consultants. So talk to me about the process of, I guess, expanding the business so much to need consultants, or when did that change happen for you?
So in terms of needing consultants, we do have a pool of consultants. So it's primarily myself. And then as depending on the requisitions or the contracts or the demand at the time, that I may outsource certain roles or certain jobs to consultants with the Public Health Network. And it could be something as simple of, hey, we have 1,000 applications. I need somebody to sift through these 1,000 and give me, bring it down to 50 or to 100 that I can look at. So I would say it kind of got to that point with the consultants. It's not they're not people that I use with every requisition, again, just based on demand or any other time constraints that I may have. I would say after that first year, it was like, okay, I might be onto something. Let's see if we can outsource some of this work. And so it's not just the recruitment part of it, but also if there's a need for like resume services and things like that, then we may outsource that.
Okay, and that makes sense. So talk to me about the applications on the back end. Like when you're reviewing applications, is that through do you use a software?
So different platforms. For Indeed, they do have like a back end for companies that are hiring. So I'm registered with Indeed and Idealist as a company. And so on that back end, Indeed has a very nice platform where you can schedule interviews and even do it, I think, through Zoom through that platform. So that's pretty easy. And they also have the ability to move candidates or applications in a yes or a no. Within the Public Health Network, we do have our own ATS system, applicant tracking software. And so you'll see that, a lot of times when people are talking about improving your resume, and there's absolutely something to it. So I'm literally able to upload resumes and it will pull candidates that match the keywords that I'm looking for. So that's done pretty easily. And if there's a certain candidate that I'm looking for, I may just go in the system and just look at them, one by one if I have to.
Okay, awesome. Thank you for that. And how do you balance your full-time job and then this on the side?
Making the best use of my time and also automation. And so one of the things that I learned early on, we talked about social media and kind of how much time it takes creating posts and things like that. So really valuing the time that I have and making sure that I'm staying on schedule to whether it's designing Instagram content or looking through applications, honoring my time and saying, I have 2-hour blocks. This is what I'm going to get done. Making use of the weekends. It's not always fun, but it's definitely something that I have to tap into. And then I'm pretty big. I have to have 8 hours of sleep. And I know there's a lot of entrepreneurs that are like, you can't be successful, but I cannot function on anything less than 8 hours of sleep. So weekends are probably my lifesaver at this time.
Okay. And did you like throughout your career, did you think that you were going to be an entrepreneur and start up a business or anything like that?
Absolutely not. No, I did not see this coming whatsoever, but when it presented itself, I'm like, I know this will work. I know that this is a good idea. Despite those 2 people or 3 people that said no, those haters, that I'll eventually turn into consultants or customers. I didn't see it coming, but it made too much sense and it felt too right for me to ignore.
Yeah, and that definitely makes sense. And there definitely is a need there. I feel like public health is exploding in people knowing about it and as a field. And I feel like we need more public health rules in a lot of different organizations. Hopefully the funding comes for those rules, but that's a whole different story. But
Right.
yeah, you're definitely positioning yourself very well here, and and I love to see it. Love to see it.
Thank you.
You're welcome. What was I gonna ask next? Where do you see this business like pivoting when like after COVID-19, or do you think things are just going to be pretty much the same?
As far as a public health network,
Yeah.
yeah, I think that it's going to continue to expand. After COVID-19, the great news is, now with COVID-19, a lot of people are getting used to, working remotely and having engagements, through the computer. So that definitely helps in terms of building connections and establishing relationships. But I think over the long haul, the next year, 3 years, it's definitely going to explode because public health is now at the forefront of people's minds. And I think 3 or 4 years prior, a lot of us found that we'd have to kind of explain what we do to our friends. But now it's like, no, I'm the superhero in this room.
Yes, yes. Okay, awesome. So I guess where would you like to see the business in the future?
In the future, I definitely see it expanding. Perhaps maybe not going the consultant route, maybe having more full-time recruiters. And I absolutely see the interest and the need for it to expand beyond the United States. I've had a few people reach out and express some interest in wondering if we're working, outside of the U.S. So I absolutely see it going global.
Okay, awesome. I look forward to seeing that expansion. That would be dope.
Awesome.
And where would you like to see yourself in the future?
So in the future, I would love to see myself still with 8 hours of sleep a night. Maybe just 10xing, the automation. So making sure that things are really automating and running without me necessarily having to be in this seat or being in this position. I think 10 years from now, I can see myself kind of going towards something with animals or dogs or something like that, but still having my hands in the public health network.
Okay, awesome. I think there might be like space for recruitment of dogs on organizations as like therapy dogs or something of that sort, like mental health, happiness.
Yeah,
It's coming, it's coming. It's going to be
absolutely.
needed. Well, before we jump into the Furious Five, is there like actually, yeah, okay, now I remember what I was gonna say. Yes. So are there any entrepreneurs or any other like resources that you listen to that you would recommend anyone else listen to get into like an entrepreneur like mindset to
Mm.
do this kind of work that you're doing?
Oh man, that's a great question, Amari. So there's a lot of them. There's a lot of podcasts that I listen to. One of which is the Impact Theory. His name is Tom.
Yeah,
Okay, you're
yeah,
nodding your head.
I
Right.
know him.
I would also say Lewis Howes. I think he does a podcast as well, and I think his podcast is something about the house of, or maybe that's his book, The House of Greatness. But Lewis Howes is another one that I listen to. The Successful Mind podcast is another podcast that I listen to that talks a lot about entrepreneurship and the mindset of an entrepreneur. On Instagram, a great account to follow is the Six Figure Chick, and her name is Cece. I can't think of her last name, but she recently passed, but her account is still continuing through her family. But she's awesome in terms of mindset and business.
Okay, awesome. Thank you for sharing those. I'm definitely going
Sure.
to share them with other people. And was there any big mindset things that you had to overcome when you were building this out?
Great question. I think, and I'm not going to say overcome because I feel like every now and then it still pops up. I don't think I've mastered it, but I don't necessarily know if it's imposter syndrome or maybe the fear. Like I think that there's this innate belief with the public health network that it's going to do well and that it has the potential to do well. And I think sometimes that the ideas that I have for the business may like scare me a little bit. Like, are you thinking too big or is that realistic? And I think that's kind of what I continuously need to reframe and work on when it comes to my mindset.
Okay, awesome. But
Great question.
yeah, thank you. It just popped into my head. But I think that you have to think too big. Like if your dreams aren't scared, you're doing something wrong. And So definitely push big, and I'm looking forward to see the Public Health Network, and I'll definitely have you back on, like when you expand to globally doing things. Like let's chat about
Awesome.
that progression. I'd love to hear
I would
about it.
love that. I
Yeah,
would love it. Thank you.
awesome. Yeah, my pleasure. So moving on to the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
For a student pursuing a career in public health, I would advise them to take advantage of opportunities and, more importantly, really foster and establish relationships. Throughout my public health career, literally every role from that internship to the State AIDS Prevention Manager to the Public Health Network, relationships that I've had throughout my career have absolutely served me in presenting opportunities and just helping me grow. So relationships would be the biggest thing, and then opportunities would be the second.
Okay. Number two, if you were to talking to someone wanting to get into your position, what advice would you give them?
So I would, in my position as a recruiter, the advice I would give them is to just be personable. Make sure you connect well with others, understand what you're recruiting for. In the role as the HIV Prevention Manager, I would advise them to be intentional about their work and making sure that they're building upon their skill set and their expertise. And even if something doesn't seem to be related to their interests, there may be a way for it to fit in there.
Okay, awesome. Number three, what's something you're working on improving in your life right now?
I working on improving. I would say probably staying present and just being in this present moment. And COVID-19 has definitely given me plenty of opportunity to do that. I think prior to COVID, it was kind of just ripping and running and going on to different tasks and things. But I think I'm really just trying to be intentional about today and the moment, and not necessarily forecasting or trying to predict the future.
Okay, thank you. Professionally, do you recommend anything? I guess besides the podcast, you did recommend?
Yeah, yes, absolutely. Besides the podcast and besides following the Public Health Millennial on Instagram and the Public Health Network, I recommend just continually learning and building additional skill sets. As far as like a book, I talk about relationships. Again, I think it's very important, no matter if it's a public health career or anywhere in your career. One book that I absolutely recommend to everyone is Never Eat Alone. And the author is Keith, I believe, Fazari, I think is his name. And a mentor recommended me that book. And it talks about the importance of networking, and it actually gives you practical information of like how to do this.
Awesome. I'll add that to my list.
Yeah.
And last but not least, where can people connect with you and the Public Health Network?
So people connect with me through the Public Health Network at our website, www.thepublichealthnetwork.com. Also on Instagram at the Public Health Network. And then with myself personally, I'm on LinkedIn as Brooke Mootry. And then one thing I just want to share with your viewers is that the Public Health Network does have a talent network. And so we do invite public health professionals that are interested in job opportunities to upload their resume. It's free. And that's a database that we use. I talked about our applicant tracking software, but that's where we go to source candidates initially if we have a position to fill. So if anybody's interested, I definitely encourage them to do that and upload their resume.
Awesome. Thank you for sharing that. And there was one question that popped into my head. So you said that now with your full-time position on Public Health Network, you I guess schedule 2-hour blocks of time. Was that something that you did before you were doing these two things?
No, not at all. So prior to the Public Health Network, it was just like, oh, it's 8 o'clock. Let's start at the day. Let's hop on email and see what comes up and respond to that. I think now with the Public Health Network and just being an entrepreneur, it has definitely heightened my sense and awareness of time. And when I have competing priorities or a contract requisition that has to get filled, I don't necessarily have time for TikTok. It's about getting these candidates and going through these applications.
Okay, awesome. Thank you for sharing that. Well, thank you so much, Brooke, for being on the show. I really appreciate your insights and you sharing everything about your career path as well as Public Health Network. I really dug in there, and I'm glad. I feel like that it's not information we talk about a lot, like recruitment and stuff. So I'm glad that we got to share this, and I feel like this public health network is going to be big just because public health is big and it needs to be bigger, and we need specific recruitment sources for this, and it seems like you are filling that gap. So thank you for this work that you're doing to really create a better public health workforce as we need it, so thank you.
Absolutely. Thank you so much, Amar. I really appreciate you having me on your podcast, and I know I speak on behalf of others. Thank you so much for the work that you're doing with the Public Health Millennial and just bringing and shedding light on different public health careers. It's definitely a resource I wish I had years ago. It probably would have convinced me to get my MPH, so maybe I'll just put the blame on you.
I'll take the blame, but thank you. I really appreciate it.
Thank you.
Well, I'm glad that I got to have this conversation today. I know there's a lot of value just on the recruitment side, on the entrepreneurship side, on her role getting there. And I think Brooke has a lot of value that is going to be given to the public health world, not just in the US, but globally. As she continues to expand its business, there's no better time for Brooke to have gotten into this business than now. And I'm just really happy to have gotten her on the podcast now before Public Health Network blows up. And I know that this is a time that a lot of people have been looking for jobs and stuff like that. So if you are, definitely reach out to Brooke. She is a resource and somewhere that you can get value from. But everyone, have a great week. Have a great night, morning, day, and I will see you all, or you will see me all next week. Public Health Millennial out.